for the introduction. I'm really happy to be here and share with you kind of how we've changed our approach at Sanford to delivering healthcare and how we're engaging physicians, nurses, frontline staff, and also business partners like Intelligent Insights to help us understand the opportunities that we really haven't been able to see up until this point. So, you know, there is so much change happening, and why is it happening? And I'll get to this in a little bit, but the change is really going to set the stage for delivering healthcare differently in the future. One of my bold statements that I made to Shane, and I think maybe why I got invited, and I probably won't be invited back and I might be fired, was I got to share this with you guys. It is just stressing me out. So we went to the Moorhead Clinic. Who was all there? Moorhead Clinic, right? RTLS, beautiful clinic. Everything's moving seamlessly, flow, great, find everything. I walked away from there with more anxiety than I've ever had in my life. And the reason why was I think we might have built the clinic too big. Right? So as we look at payment reform and technology, we might not have to deliver care the same way we always have. I also want to overlay with that comment, we always have to balance the quality and patient outcomes and our physician leaders as we look at changing the way we deliver care. Because at the end of the day, our greatest asset are not our wheelchairs, you know, not our pumps, not our thermometers, anything like that. The greatest asset are our patients and the people who deliver care to those patients. But I do think there's huge opportunity for change, and we're really excited to be here and be partnering with Intelligent Insights going forward. So healthcare, an industry in the midst of change. This slide, to some, might mean storms are coming, bad days are ahead, right? But I love this slide because if you think about it differently, this is the perfect storm that needed to happen. What I see here is innovation, data, and technology colliding with payment reform. Finally, there's a break, and we can be doing things differently and not so hung up on the old way and the old culture and the old systems. Now we have this opportunity, and I'll get to the payment reform piece of this in a second, but that is really the window that's opening up this opportunity that's allowing technology, that's allowing information and data to be used differently and how we deliver care. At Sanford, and me personally, I see this as probably our time to lead and prosper and not run and hide. So I really appreciate conferences like this that make us think, that challenge our thought processes, and I want to engage you in this and to kind of talk to you about what we need from you going forward as well. It's not a one-way street. It's a two-way engagement with all of you in a multidisciplinary group and how we can do better going forward. This next slide is those who are sticking their head in the sand. I think I saw a head in the haystack yesterday. I like that one. That was pretty cool. You know, this is what you're seeing. You're seeing, you know, hospitals closing down, cuts, payments, you know, just bad signs. And what my concern is they didn't recognize soon enough the changes that are right in front of us and didn't adapt and move forward. And that's a little bit what I want to talk about today. But before we can move forward as an organization, I had to move forward individually, and that was pretty tough for me. So I'm the oldest child. You know, I've got stubborn upbringing, German, you know, Scandinavian, just, you know, I don't like to change anything. I'm so ritualistic. Every morning at 5:30, I'm at Starbucks, waiting for the drive-thru to come on so I can order my cup of coffee and get to work. I mean, that is regimented. I do it every day. So I had to challenge myself to think differently. 7 years ago, when I had, as you saw in my earlier picture, and was a little bit thinner and really rambunctious about being a healthcare administrator, I saw this picture and I went, yes, we did it. Full waiting room. The doctors are going to be so happy. The nurses. I'd walk through it, high-five people, and I've got this big smile on my face, and now when I walk through the waiting room, I realize this is a disaster. This is a complete and utter disaster and a failure on our part. And I want to thank people like Jeff Haas and some of the colleagues that I work with every day who keep pushing us and realize as well that this is a disaster. And the doctors and the nurses, Dr. Sand and others here in Fargo at our Moorhead Clinic that said, this is a disaster too. We can't have this anymore. You know, we got to be better than this. And what does it do to the patients? What do patients think about this? I love the Chick-fil-A bag in there too, by the way. I bet their diabetes scores probably aren't so great. But what does this do to patients? This isn't a good setting. This isn't stress-free. This isn't what they want. What about our nurses? What about our registrars? What about our physicians? These patients, they're probably pissed off, right? So when they get back there, you think they're in a good mood, they're ready to engage and listen? No way, not a chance. So I'd walk through and I'd high-five everybody, and I'm sure I'd walk back, and go through the clinic and leave, and people are probably looking at me going, are you kidding me? How disengaged is this person? They don't get it. So that was my own mental transformation, that I had to look at these types of things like our big clinics and our waiting rooms full of people, and say, this can be different, and we can do better than this. So, and I challenge all of you to think the same way. So our current reality, this is my personal bias. It's not endorsed by Sanford, so please, whatever happens in Fargo, stays in Fargo. I do need my job. But I believe the Affordable Care Act is here to stay. It's been a catalyst for change, and it isn't going to go anywhere. I think some of the nuances of it will be changing over time, but for the most part, health care for everybody is not a bad thing. And that's really how I summarize the Affordable Care Act and kind of how that's changed and given us an opportunity to move forward in a different way. Patients are going to be more involved with their health care choices. They're going to be making decisions based on cost, quality, and experience. And the last one is the most important. No offense to all the patients in the room here, but I bet a lot of you walk into the room and see the doctor with the fellowship or the residency degree and believe that that's high quality and I'm going to get the best quality clinical outcome. And so what do you rate us on? The experience. Did I wait long? Was the room messy? Those types of things. Experience is very important. More transparency and quality will also be very good for us as a healthcare industry. Employers are changing traditional healthcare benefits for employees to more of a fixed cost, which pushes more responsibility back onto the patients, which again drives them back to making decisions based on cost, quality, and experience. We have to understand that, and we have to know there's choices out there. And also, new technology is reshaping how customers and consumers access their health care. Telemedicine, e-visits, kiosks, those types of new disruptive technologies, those are the options for people out there. So we've got to be on our game as a big integrated healthcare delivery system with 27,000 employees, 1,500 fantastic physicians, nurses, everyone alike. We have to be able to move on a dime, or we will be lost. So I want to talk a little bit about the payment methodologies. So for those of you who aren't in healthcare, you're lucky, because this is probably the most frustrating pieces about the system that we all deal with every single day, and that's payment and how we get paid for the services we deliver. Today, fee for service. Basically, every time you come in, we get reimbursed for that care that we deliver to you. And tomorrow when you come in, we get the same. They've added in a little bit of at-risk, so today if we got paid, $50 for a physician visit, next year it might be $52, and they'll put the $2 at risk. And insurance, are there any insurance payers in here? I gotta be careful. Oh, wow, that was good, I'm glad. Although we are an insurance carrier ourselves, but anyways, Ruth loves me. But anyways, and small increases each year that are held at risk for some quality measures, and it's been good, and it's been kind of our toe in the water. But really, tomorrow what's happening, and a lot of you have seen these terms, it's accountable care, it's medical home, it's fixed payments, it's bundled care, it's shared savings. What does all that mean? As far as I'm concerned, it's a fixed payment. I'm going to pay you $500 to care for this episode of care. I don't care how you do it. You can do it via telemedicine, you can do it via kiosks, you can do it with home visits, you can do it with questionnaires, you can do it however you want. And I think that transformation and that ability to allow physicians to decide how they want to deliver care, where it meets the patient's needs best, delivers high quality, and delivers a fantastic patient experience, this transformation is what has really, is that perfect storm now that's coming together that's allowing us to do things differently. Before, we couldn't get paid for it, and that's what held us back. That was kind of the sluggishness of our industry. So that's why I think we're at a critical point right now where when we have an opportunity to partner with people like Intelligent Insights and many of you within the audience today to help us understand how we can do things differently and improve how we deliver care. So what does this new reality mean for you? Obviously, more focus on the patient experience. Visible quality measures, we talked about that. Improving processes and reducing costs is really our new way of life. This is what we do day in and day out. This is why I don't have hair. This is where I have to get up at 5:30 in the morning because I can't sleep because I've got anxiety about everything. I probably need medication, but that's all right. But that's what this is all about. That's what we do day in and day out. And it just is our new reality, and it's our new reality for all of you and all of us, so let's embrace it. One of the things, and actually this got me up in the middle of the night last night thinking about this slide, Kodak's missed opportunity. How many are familiar with Kodak? Obviously, right? Probably everyone in this room over the age of 20 probably has taken a picture and then developed film, and it was probably Kodak film, and they made millions of dollars for every Kodak moment that was out there, billions of dollars actually. Well, it actually was one of the first companies in 1980, actually earlier than that, to develop digital photography. And I think one of their issues was they're a big company with lots of infrastructure and lots of people developing film, making film, all of that, and just raking in the cash cow. But I think what happened is they failed to reduce investment in their traditional film and strategy while increasing their emphasis in the digital world. And so what happened is one day they woke up, literally it was 1/4 difference in their stock reports, and they woke up and they were losing millions of dollars and laying off tons of people, and it's all because that flipped in an instant. The technology came in, it was disruptive, and now we're taking pictures on our phone. I haven't even seen a piece of Kodak film in probably 15 years. So what does this have to do with healthcare? Well, yeah, we take pictures in healthcare all the time, x-rays, things like that, stuff for dermatology. But what does it mean to healthcare? It means that, what it means to me is it's a symbol. And if we don't adapt, we'll have patients leave our organization. They will leave our physician practices, they will leave our integrated model of healthcare delivery, and they will go to boutique clinics, they'll go to the Zipnoses, they'll go to all the things that was somewhat talked about yesterday, but there's more opportunity out there today, and if we don't meet those challenges head on as a big integrated healthcare system, we'll miss our moment. So what is our moment? Our Kodak moment is technology. Look at all these companies that are investing in technology. Key partners in telehealth is a slide. I mean, you name it, they're all there. And if we think that we can stick our head in the sand and not have to worry about this, we're crazy. And this also is what keeps me up. Maybe I do need medication. So what do we need from you? Business leaders, drive wellness. Wellness is so important for our communities. Enhance your focus on employee wellness and prevention. Push us to deliver healthcare differently to your workforce. I couldn't sit on one of those balls if you paid me. But what I could do is I could see myself using a kiosk or a virtual visit or something like that, when I'm wondering if I'm sick and not having to take time off of work and, take the kids to daycare and all that other stuff. I could see that being a real opportunity for the business world to keep employees well and also reduce their time away from work. And I don't want to use PTO to go to the doctor. I want to use PTO to go to Cancun. The innovators, we need you. We cannot do this alone. We are so layered in bureaucracy in healthcare, and we're so, how do I say this, unimaginative, uncreative. We can't do it without you. We need partners. We have to partner to drive some of this. We need mobile integration. We need remote monitoring. We need business and data analytics. And we really need you to help us understand when we're missing the boat for patient experience and convenience. So please, don't give up on us. I know we're frustrating, but we do know we need you. Individuals in the room, embrace change. It's happening. It's already happened. It's here. It's not bad. Please engage with us. Please tell us how you're feeling. Let us know what's hitting the mark and what's missing the mark. Understand your genetics. This is a key one. We talked a little bit about driving down costs. As a taxpayer, as a patient, I want everybody to get it right the first time. We're not going to be able to get it right the first time unless we understand our genetics and our genetic makeup and what we're predisposed to have happen to us or what is or isn't going to work. So understand your genetics, pay attention to the genetics components of your healthcare, and really what it means to me is it's precision medicine. Genetics is precision medicine, and that's the future of healthcare. And advocate for this. I mean, right now, there's hardly any genetic coverage out there from any of the payers, including Medicare. So, there's just a huge opportunity there, so engage, understand, and push for it. And communicate to us how you would like care to be delivered to you and your loved ones. We think we have the answers. We don't. We need to understand, and we need to hear from you. Help drive that, please. The patient experience, it's shifting. I mentioned earlier how important patient experience is to our industry. Is anybody here familiar with Shields? I bet you are. I hated Shields. 5 years ago, hated them. I thought it was overpriced, never liked to go there. I always went right to the clearance rack. Today, I love Shields. I still think their prices are a little high. They have great quality products. But now this is an experience for me. Pretty much every other Saturday, or maybe once or twice a month, my kids make me go to Shields. I don't need a new Under Armour golf shirt. I don't need golf balls. I don't need anything. They like going there because of the dang Ferris wheel, and they got this little touch game in the front that you're playing, duck shoot or something like that, and my son could stand there for 4 hours. It's the experience, and I guarantee you, I spend probably $10 or $15 feeding the slot machine in there so they can play duck hunter, or they can bowl the bowling ball down the lane, or they can ride the Ferris wheel. But I guarantee I'm walking out of there with something else, a new pair of shoes, something I didn't need. But that patient experience is so key. What they've done with the retail environment to bring people into that retail shop and give them an experience that's so much better, so much greater than just shopping, is just unbelievable to me. And I really think they hit a home run, and I think we can learn a lot from that. Now, I'm not saying we're putting Ferris wheels in the Moorhead Clinic. Don't give me, I can just see that capital request coming through. We're not going to do that, but I think we need to change how we think about how our patients experience care and have more fun. This is a quote, you can read it, from one of our patients that visit our Sanford Moorhead Clinic. This is a shining star of our organization. I'm so excited to have data now coming back so we can understand the impact we're having to patient care, and then how do we replicate that across our enterprise. We have 225 clinics. That's a tough challenge. That also keeps me up at night. But we're so excited that we have the commitment to create efficiencies and be smarter about the work we do every day. And I can't thank Intelligent Insights enough, because before, we didn't have the data. We were just guessing. Now we've got it. Now we've got the spaghetti diagrams. The data is irrefutable. It is guaranteed spot on. And we're going to be able to really change how we deliver healthcare, because we're going to use data to help us do that. And so I think this will be key for us as an organization moving forward, and any organization that's looking to transform how they deliver care. Last but not least, take care of yourself and your family. There is nothing else. Enjoy what you do. Think about the things we talked about today and how you're taking that back to your organizations and partnering with us to deliver healthcare in a new way, the way we all want it. And I appreciate your time today, and thank you very much for coming.